Mark Donovan, Shropshire Community NHS Trust, Patient Experience and Engagement Lead. Observe and Act is a tool that's been put together by volunteers, patients within our trust, in conjunction with staff. We've been using this tool for several years now and sharing it with other trusts with the support of NHS England and NHS Improvement. The purpose of the tool is to examine a person's total experience of a service from the service user carer perspective, and to learn from it, share good practice, and where necessary, act to make improvements. We have lots of other feedback tools like many other trusts do: patient stories, real-time FFT, focus groups, surveys, etc. But we do find Observe and Act a very useful, detailed, unique tool that gives us some very rich information that we certainly try and join the loop on. Observe and Act, it's important to understand that it's not an inspection, it's actually a journey through the eyes of a patient. So it's not judging clinical judgment, it's through the eyes of a patient, and it's very important, and that's very beneficial, that feedback back to the staff about that. The process of Observe and Act, first thing we do is decide which service our observers, trained observers, are going to go to. We may look at the whole service or just a small part of it. Once that's done, we provide instant feedback to the person in charge or the relevant person at the service, and we'll talk about good things, which is very important, and areas that need development as well, which is also key. And these are fed back and shared with the team, and actions and next steps are then agreed with an action plan. And sometimes that can be action locally. If it's bigger, examples of bigger things that need doing, it might be expenditure and other things, then it can come back to one of the central groups or decision makers in the trust. We have 5 themes within the checklist on the Observe and Act action plan: environment, communication, person-centred care, food and drink, and safety. And during the training which we give for Observe and Act, and obviously when we go and do practices as well, we look at lots of examples of these themes. So it may be something really simple. On environment, it may be signage, or it may be flooring, it could or something really practical, or it could be to do with communication, how people are welcomed by staff, or reception. So that we go through all sorts of details within them 5 areas. There's now a 6th area around diversity and inclusion as well, which Wolverhampton have helped us develop. Key points. This is used by all trusts. It's a very flexible tool: mental health, community, acute trusts, specialist trusts, social care. So it can be used by all. There is immediate feedback, which again, compared to some inspections and other tools, is often a drawback, but it's done there and then after an hour and a half of doing the observation. It's a regular source of evidence, and it complements the other tools that people use as well. And it's through a service viewpoint. Even if we do have staff and volunteers that do it, at the end of the day we're all patients, but it's being seen through a patient's eyes. We're in it together. It's not an inspection. Our staff actually welcome it and learn from it and action it, and very much it's important that we do action and join the loop, and we do that, as I said, instantly, locally, or centrally if it needs. It's a bigger issue. Recognition is key. And just to finish off, the university and we have an informal network are involved in the evaluation of the tool independently, and NHS England and Improvement have worked with us and supported us, and we are continuing to develop the tool with them both. We made a video with our staff and some volunteers who talk about observe and act, and from both ends really, what it involves from those that observe, but also from those who've been observed. It may be a ward sister or a service user manager who honestly say what they think of observe and act, and particularly many of the benefits that they really stress, to be honest, which we're now going to show. Thank you.
My name is Elizabeth Morris, and I carry out Observe and Act observations on behalf of the Patient Carer Panel. The observation involves asking people about communication, person-centred care, environment, food and drink and safety. Observe and Act is a positive process where I go into services and I talk to patients, I talk to their families and I talk to staff. And I try to get the overall experience of the patient. And then all the positive things are recorded and fed back to the staff. We also look at things that may need improvement. These are again recorded, and all the good things and the improvements are put in an action plan at the end and discussed with the manager.
My name is Philippa Saunders. I'm the team lead for DART. DART stands for Diagnostics, Assessment and Access to Rehabilitation and Treatment. Bit of a mouthful, but we offer rapid access to diagnostics, assessments. We offer treatments, blood transfusions, intravenous therapies, iron infusions. So we do lots and lots of different things within our small department. The DART team has been involved in the Observe and Act from the very beginning, and it's something that we've done, and as it's changed we've adapted and supported people doing the Observe and Act within our department, and it brings so much to us from the perspective of a team and understanding what we're doing well and what we need to improve upon within our department. From our perspective, Observe and Act has been really, really valuable to our staff and our patients and clients. We have many people coming to do Observe and Act within our department. Our communication skills, our caring skills have really been highlighted, which is excellent for the staff and for the patients, obviously. There are some areas that we need to focus on that are difficult for patients and for staff, and those areas are really our environment. Our environment is very, very small and it is very, very hot within our department. So those are areas that we really want to raise.
Hello, my name's Michael Hill and I work in the finance team at Shropshire Community Health, and I undertake Observe and Act. I enjoy undertaking Observe and Act because it enables me to see lots of different services out in the field and enables me to see all the good work that we do out there for our patients.
Hi, my name is Rachel Brown and I'm the Clinical Services Manager for 2 community hospitals, which is Ludlow and Bishop's Castle. So I think one of the really valuable points within Observe and Act is that we have different people coming and doing Observe and Act with us. So some of the people that partake in that could be volunteers, or they could be particularly like non-clinicians. There could be people from the finance department or people from HR, so we get a real mix of different people that come onto the areas to do it. So some of the advantages of that is that they bring with them a completely different skills and different perspective on that care that's being delivered. So for example, they'll ask different questions to what a clinician would ask, because obviously clinicians used to working in that environment. It's stuff they're doing day in, day out, so it doesn't look any different.
Hi, my name's Liz Watkins and I'm Head of Infection Prevention and Control for Shropshire Community Health Trust, and I've been involved with Observe and Act really since the very beginning, looking at the questions that we wanted asked and again looking at how the forms and how best we can take this forward. I've been involved with Observe and Act since the very beginning, looking at how we develop the tools and how we can best use this to move our organisation forward. At the moment I'm quite used to doing audits as Head of Infection Prevention and Control, so I'm quite used to going out and looking, but it was looking at different areas, it was looking at different environments, so I find it a really, really useful, really beneficial way of looking and observing. The feedback's really useful because they get it almost immediately, so if you've got staff there you can say to them, hang on a minute, can I just draw your attention to this, or it gives you the opportunity to question further, so you're not going away, writing a report and sending it to somebody 16 weeks or whatever else later. They actually get it there and then, so it's an opportunity to change practice and change environments there and then. Obviously if you can't deal with it At that point, you can then take it back and we can look at it as a trust, or we can look at it as a whole, really. Observe and act, you're looking at lots of different parts of the environment, but also you're looking at patient safety issues. So you're looking, from my point of view, is hand gel available? Can staff decontaminate their hands? Do you see staff decontaminate their hands? But also from a patient perspective, so you're looking at, is the environment clean? But people will feedback to you there and then. So it's about trying to place yourself in a different role, but actually looking at lots and lots of different environments and speaking to people. So you're speaking to the patients, but you're also speaking to the people who've brought them there, the carers, anybody really. Also staff that are there in the environment, because they pick things up and they can clarify things that you've never really thought of before. So I find it really useful and really beneficial.
I think that Observe and Act is a good thing because it helps to improve the quality of care of the service, but it doesn't forget to ask the service user about that. And it's the inclusion of the service user that's most important. It's getting their views.
I feel that the feedback that I give to the service is listened to and acted on, and I think it makes it a valuable part of this exercise.
It's useful because it's happening in real time, so obviously the observers see it happening and then we can feed that directly back to the staff that's working on that shift or in that department at that time.
It's proved to be a valuable tool that my team and I would not be without.